What is the nasolabial fold? Why do we have them? Why did it get worse over time? And what's the best way to treat them? Hi, I'm Dr. Delaney, a facial plastic surgeon. And this is a question that I am answering almost on a daily basis for my patients. And if that many of my patients are confused about this subject, I'm sure many of you out there would appreciate some clarification as well. The nasolabial fold is the fold that we develop here kind of from the side of the nose down to the side of the mouth. And you can see in this example, as we get older, what you'll see is this fold tends to get deeper and deeper and more pronounced. Now, why is that? And let me show you in the next few images in terms of the anatomy, why do our nasolabial folds become more prominent? So the reason we have nasolabial folds at all is because the muscles of facial expression attaches to the skin or the dermis right here in the course of the fold. So you have your levator labii superioris, aliquot nasi, levator labii superioris, zygomaticus minor, major, risorius, and your smas coming down here in a confluence as the modiolus. And so all of these attachments allow us to smile and have facial expressions. And so they're all densely attached to right here. So you can't really inject anything, you can't really put anything in there because it's just the muscles are attached to the skin. So you're not really going to be able to fill that area. Furthermore, right above all the insertions of the facial muscles where you have that dense attachment, you have a superficial fat pad called the malar fat pad. So when we're younger, what happens is this is nice and tight, and this fat pad is up here closer to where the infraorbital rim is under your eye. And then over time, with gravity and increasing laxity over the overlying tissue, the fat kind of starts to move down and inwards, and then you'll have it hanging over the nasolabial fold. Now, you'll never see the fat cross the fold itself. It'll only hang over, kind of the way that a man with a really big belly and a really tight belt, his belly will hang over the belt, but it won't go underneath the belt because this is so tight, there's no way the fat's going to go underneath it. Now, I do need to make a quick point is over time, our skulls do change and we lose volume here in the maxilla and in the mandible, so there's less support, so the volume does go back a little bit. And so that does have a little bit of implication for our treatments. So what is the best treatment for deepening nasolabial folds? And this is something that I explain on a daily basis because it's confusing. You see a deepening here and automatically we assume, okay, I must be losing volume right here. Well, as I explained earlier, this is where all the muscles are attaching. So the nasolabial fold is not a site where there naturally is a lot of fat, nor is it a site where there's naturally a lot of fat loss. So I did mention that we do have some bone loss over time. So up here in the maxilla, this is somewhere where we could put something like a little bit of filler to provide a little bit more volume and projection, but that's not really the definitive treatment for the nasolabial folds. The reason the nasolabial fold deepens over time is because of the laxity of the muscle layer, the smas, descent of the malar fat pad, so it's hanging over the edge of this connection. So really the definitive treatment is surgery, a facelift, preferably a deep plane facelift or a mid facelift through a lower blepharoplasty access to elevate the structures. And a lot of times we'll see patients intuitively go this way, right? They're like, oh, it's better if I just go like that. Well, that's surgical, that's a lift. So when considering nasolabial folds, and if yours are bothering you, you need to recognize that this is not a volume deficiency issue. This is a tissue laxity issue. And if you keep filling up your nasolabial folds with whatever injectable, it's not going to fix the underlying problem. You'll probably be frustrated and you incur potential cost and potential complications for not a lot of benefit.